Hello, I'm Dr. Bill Johnson. I'm coming up here with my mask on for a purpose, and I'm doing exactly what Bob and John just did off camera, and everybody else in the room is having a mask on. And I'm showing you how I take this off and set it on a piece of cloth. I was asked to talk a little bit about safety for the public, and I guess first thing I do want to say is to the community of Lincoln and Nebraska as a whole, but the way we've talked about flattening the curve, and yes, you did, and you ought to all be tremendously congratulated by that. You've absolutely saved lives by doing this. You've allowed us the opportunity to do what we do and actually allowed our hospitals here to take care of other communities and be prepared. And for that, we thank you. We have to think about other strategies because you've all put forth an effort, made sacrifices to allow this to happen. And we want to take what we've learned, because we have learned some things over time, and we want to share that with you to help make this as safe of a process as we can. I've talked with Dr. Jocelyn Herstein, who's a public health infectious disease specialist out of Nebraska Medical Center, and we've had some discussions about this. And the absolute key to this whole issue is the asymptomatic carrier. And the real issue that we're facing is a person who feels well, who may misunderstand the fact that they're a carrier and unwittingly transfer disease to other people when they don't think they have. And unfortunately, when that happens, the cat is out of the bag, and that's part of what we saw happen. And as we try to do things like tracking down cases, case tracking, I believe they call that, those things work and help, but it's very helpful to try to stop this from the very beginning. Herd immunity is probably more considered a catastrophe and not really a strategy. I don't think that the initial thought where there was going to be a certain number of people get infected by this no matter what is necessarily true. Yes, flattening the curve is important, but I also think that there should be a goal that maybe we try to reduce the number of people who get ill as much as possible until we can get a real game changer that comes along, such as a vaccine that may really help us change what happens. For those of you that have had this, for those of you that have had a person die of this, to you, and that person, the mortality rate's 100%. And that's what we feel as your care providers. We take that to heart. We don't want to see deaths. We don't want to see people get ill. And we don't want to have the fact that, well, our hospital is doing okay, so, well, let's let people get sick. We don't want that to happen either, nor do any of the people that are leading this and leading us going back into our economy starting up. They want this to happen as successful and as healthy of a way as we can. And because all of you have helped us, we've thought, how can we help you? The Lancaster County Medical Society and I know the Nebraska Medical Association are going to start putting out some word on this, a physician campaign, if you will, to help you understand what it means to truly protect yourself, to self-distance, what that really means. And I think to start off with here, the hand washing, don't forget that. And I always tell all my patients, protect your home. When you first come in the house, wash your hands when you first get in the house. Get your house all wiped down. Anything you bring in there, you wash off and you have your hands protected. Get your house a barrier around your home so that you're safe. When I come home to my wife at night, I take off all my clothes and go get in the shower and throw things in the laundry. Washing your clothes, if you've been out in public, is a good thing to do, and certainly for anybody who's exposed. Hospitals have done things, and we've done things to protect ourselves and to protect our patients through the years. And there's a term we call universal precautions, and it means a lot of different things to us, but I'm going to use it in this circumstance for all of you. That's really what we have to look at. If we're going to stop that asymptomatic carrier, we have to have universal precautions. And if you look at, we have a graph up here that shows two people that are not wearing masks. And if you have someone who's a COVID carrier and they're unwittingly thinking that they're healthy, the possibility of transmission to another person who's not wearing a mask is very high. And I would remind all of you, yes, the hand hygiene, standing 6 feet apart, all those things are important. But remember, this is a respiratory disease. Where do respiratory secretions come from? They come from your mouth and your nose, and they're expelled into the air. And so somehow, some way, we have to help control that. In the past, we've done things such as the provider wearing the masks, the person who wants to protect themselves. And if you look at the next slide, what we have found in this illness, that doesn't necessarily work so well. When I'm wearing a mask, I'm not really protecting myself that well. There's actually a pretty high probability that there can still be transmission. And for those of us in the medical field, we talk about things like droplet and aerosol, and I'm not going to get into that. Just understand that the person wearing the mask isn't really trying to protect themselves. They're thoughtful and thinking about it, but if a person is an asymptomatic carrier, then that person can still transmit that if they're not wearing a mask. Interestingly, if you turn this around and you go and you find that a person who is that asymptomatic carrier and they're wearing a mask, we drop the rate of transmission dramatically because those aerosolized and droplets are not getting through. Now we know and we understand and we concede the fact that yes, an N95 mask is great, and maybe on the prior slide, if you had an N95, maybe you'd do a better job. But we understand that these masks are not all available. Procedural masks for hospitals are not all available. But still, even the CDC has stated that use the best you can. And cloth masks that are homemade are things that can be useful and helpful. And there's actually things on the CDC website on how to get these. The Lancaster County Medical Society and Nebraska Medical Association, we're going to try to get the word out to try to get masks available. I think, honestly, until COVID goes away and we get a vaccine, and perhaps the day when loop masks like this one can become available, the one that I was wearing, maybe you'll find those on the same aisle as you find your personal hygiene products and your toilet paper. That may be the way it is until things normalize out for us. If you go even one step further, and both people wearing a mask, I don't want to use the term N95, but boy, there is tremendous safety in two people wearing a mask. If two people in a room are there and one of them has COVID and they both have a mask on, there's still tremendous safety, and the likelihood of passing that on is dramatically reduced. I can't give you numbers. I don't think anybody can give us numbers, but we've seen numbers as low as less than 2% on those that when there is both people wearing a mask. We've heard times where people have said, what could we have done in the beginning to help prevent this? And to Nebraska, I'm pleading with you here, now's our chance. Now's our chance to make that difference as we move on. There was a scenario in Washington where a choir got together and 60 people were in a room and they did all the social distancing that they were told. And they practiced their choir. Granted, they were singing and you can make statements about that, but nobody had on a mask. 45 got sick. I believe 2 died just because they went to choir practice. And if they were to go back, if you were to ask that group of people if they could have all put on a mask and done what they did, there's not a physician out there that wouldn't say that outcome wouldn't have been dramatically different than what it was. Our chance is now. I have 3 kids. I don't get to see them. They're all in various universities across the country, and when we say goodbye to each other, we always use this sign. And it means love, but it means a lot of things. And when you're a parent, it means study hard. It means be careful, drive safe, take care of yourself. And it means I care about you. To those out there, I know there are people who don't want to wear a mask. I know there are people that are willing. I'm pleading with you. We have to take care of each other. Think about your neighbor. Think about your family. There's businesses who want to start. There are people that want to work. They want to do it safely. To do that safely and to make it so that you're getting a paycheck 6 weeks from now and you're not quarantined because someone gets sick, I urge you to take care of yourself and be safe. Think about those things. Think about other people. Show other people that you care. It's vital that we do this for each other. Wash your hands. Be careful. Stay your social distance. Wear a mask. Tell people that you care. Thanks. And I'll go one more point. When you take this up, I want to make a point with this. When I took that mask off, I set it down on a piece of paper so that I didn't contaminate that. I picked it up by the ear loops, and when I put it on, I don't touch the front, and I put it on. It's important not to touch the front. It's important not to touch your face. That's how this gets spread around, is when you touch other things and touch your face. Always wash your hands before you touch your face. Again, like I said, be safe. Thanks.